Hi, I'm Toni Eckert, and as a patient navigator, I'm able to assist patients with their barriers. And today, I am going to talk to you about interventions that have become successful in influencing health behavior change. So, at the beginning of this year, there was a new service program started, and I was lucky enough to get hired to it, and I'm very happy about that. It is a wonderful program with a lot of benefits and an example. So right now we have about 400 and some patients on our services, and out of those 400 and some patients, we were able to stop 60% of them going back into the hospital for readmissions, which is huge, and that is our goal. Our goal is to keep people in their homes and to take the care to them. So, we have nurse case managers, providers, we have a pharmacy team, we have a dietitian, we have social workers, we have psych, we have community health assistants. So, in which I am a community health assistant. So, we try to break these barriers down. When a patient comes on with our service, they usually have chronic disease, multiple health problems, okay? So, instead of them going to the emergency room where people are sick, we want them to stay home so we can provide that care to them, unless it is a true emergency and they need to be seen right away, 911. So what happens is a nurse case manager will go out to the patient's home. They'll do an assessment and they'll pass on anything that needs to be passed on. So if a patient needs an appointment set up, they'll pass that on. If the patient has certain barriers, they're going to pass that on. And then they're going to keep monitoring that patient. So if the patient's really sick, sometimes they might put them on for a second visit that week. They might follow up with them the following week. It just depends on every person in every situation. After the case manager makes her first or his first enrollments, we have a provider go out. So the provider goes out and the provider does pretty much the same thing, but in more depth with the patient's health overall. So now we don't, and this is a thing, people think we take things away from them when we do this, but we don't. We don't take the patient's primary doctor or physician. We don't take any of their specialists, and we don't take their already case managers or any kind of agency or anything that they already have in place away from them. We don't do that. We add to that. And we assess and we assist with everybody. So in this environment, if the patient had different concerns and the doctor brought up different concerns as well after sitting and talking with the patient, he would, then message the primary care or the specialist, and they would talk amongst themselves and make changes. Before anything, they would talk to one another. And the barriers come up all the time. And I myself was not aware of a lot of things that are actually out there for people. The biggest barrier, transportation, trying to get to and from appointments. If a person's in a wheelchair and they can't get in their regular car, there's wheelchair vans. Some people may be bedbound. If they're bedbound, you can't get them in your car. So these patients need to be seen by providers. They need to be seen by someone. So instead of calling that 911 just because you're not feeling good or you have chest pain or something, that could be nothing. We don't know. You can call us and we would be able to come. So we're on call 24/7. We also have an EMT team that can come in too. Another barrier besides the transportation is food. So you have diabetics. Diabetics can't get, sometimes, if they have a food barrier, they don't know what foods to eat. They don't know where to get the foods. Maybe they don't have the transportation. So the community health assistant can come in and assist with that too. So what we do is we go in, we sit down, and we talk to them. We build that relationship with them. And we make them know that we're there for them, to take care of them and to help them. Another thing, with educating patients and letting them know what is actually out there to help them, it's overwhelming. It's overwhelming. And to be thankful, these people are so thankful that they're able to actually stay home and have someone come to them when they need it is amazing. So the transportation, yes, I said, is one huge concern because we want people to go to their doctor's appointments if they're feeling fine. We want them to go to them. The food situation, there's community pantries where people can get food. The Salvation Army is one. A lot of local churches have food banks on certain days. So with our transportation services, we can actually set up transportation for them to get to those places. Another thing, nowadays, technology is huge and it's wonderful. However, some people don't use technology. Believe it or not, some people don't have cell phones. They don't have the internet in their home. So then we have to look for other ways of educating people and showing them different means of assisting them. So in the financial aspect, it's wintertime. Heat, electric. So there are forms that can be filled out, sent in, and get assistance with their heating oil or their electric bills. There are also other programs that some people don't even know about, like a waiver program with the aging office. And now you have to be at a certain age, 65 and older. So there is another waiver program for people under 65, but you have to meet certain criteria for that, and it has to go through the doctor. The doctor has to sign it first before we can take care of that. But those are just a few things that are out there that are beneficial for the patient. Things that we can do for the home. We can bring hospital beds in. I had a patient recently. He was on the second floor of his house. He had a nice chair glider to come down his stairs. However, his bed upstairs wasn't very friendly. They had a situation where they were trying to get him out on the stretcher, and because of how the stairs were and with the stair glide, they had a very hard time. So we were actually able to get them a hospital bed put on their first floor in a nice general location, like in their living room area. And it was, I think, the week before Thanksgiving. And the patient was downstairs, interactive with his family. He actually sat at the kitchen table and ate some Thanksgiving dinner with his family. So the positive with this program is assisting and breaking those health barriers down. Taking care and assisting these patients with their needs of financial or just health services is beneficial. And believe it or not, it's cost effective. We're taking this stuff into a person's home and helping them. It's actually more cost efficient. So the whole system alone is growing, and it's only going to get bigger, and it's only going to get better because we're working as a team. We're all in this together. The patients that have come on with our services have great, wonderful things to say about us because someone's coming. Someone's not leaving them. Like some people feel like they have no one out there, which some people don't have someone out there. There have been situations where a patient lives by themselves and their family member is out of state. So this person has no one to turn to, and they have us. So when we make our visits or we make phone calls, this is all so beneficial with the whole health barrier, breaking the health barrier and the change, making everybody understand, and not necessarily understand, but be able to cope and to be able to live a little longer. Like, live a little longer, because if those health barriers and the health issues are kind of gone, if we can take care of them, then that relieves the stress, that relieves the pressure of not knowing. And with that, you can live a little longer, enjoy your life and your last days. I don't know, it's just a great thing. You know, healthcare today is growing and the technology is only getting better, and the services are just beginning.